in.
Yeah, one in.
1 hour?
Yeah, and then back out. There you go. Good.
What's going on, guys? This is Dr. Kunal, physical therapist in San Jose, California.
How's it going? My name's Alex. I'm also a doctor. I'm a doctor of physical therapy.
Not higher level, but just wants to have no limitations.
We're both private practice owners, outpatient sports rehab. Most of the footage you'll see is at the Brokaw location, which is our first one, and then this second location in South San Jose is set to open. It probably is open by the time you see this.
I feel good. I mean, when we talk about it, it's been a long time. Like, I still remember the day that he texted me and our friend Jeffrey in a group chat, just saying damn, I think I just tore my patella tendon. Very specific. He explained the mechanism. So I immediately felt terrible for him. I was just thinking damn, that sucks. Like, he has a business to run. He has a staff to run. He's healthy, he's young, so it was a pretty bad time in his life. And yeah, I mean, we're here now, he's doing much better, and it's crazy to think about the process.
Time flew by, you know? In those first early months, it felt like every week was a month long, but then looking back on it, like you said, we're at 10.5 months now, and it's crazy to see, you know, how quickly it all kind of changed and how it got back to close to being normal, you know, again, from how big of a change it was when it first happened and all that. So I think when I first asked Alex to do it, that was kind of my concern too. It's a weird position to be in, it's a weird dynamic to have, and you might second guess it, but I wanted him to treat me like he would treat any other patient and not try to influence his own decision making. So the biggest part for me at least was, you know, working on myself being just a patient, not trying to cloud any of the treatment, and then just let Alex do, you know, what he does on a daily basis and let his expertise shine through. And there's a reason that I chose him to do my rehab as opposed to someone else, and I wanted him to just you know, do that. So
yeah, I think from the start, KP's giving me autonomy in how I treat my patients and how I think and just the way I treat as a physical therapist. So that trust in asking me to treat him, I mean, it was a great feeling. I was like, okay, cool, let's do this. Maybe there was some pressure, but I took it more as privilege, cool, but my boss trusts me to get him better and hopefully get him back to basketball. So yeah, I think it was very motivating. It was a new test to just get better as a therapist.
Well, he was the first, you know, PT I hired when the practice grew, and I get to watch him work every day. So I see what he does, I know what he does, I know that he's passionate about what he does, and he's similar to me in that I think we both pride ourselves on, you know, staying up to date with research, being evidence-based, doing things at work and challenging ourselves to be better, you know, every day with different patients and stuff. So I saw a lot of those elements, and it was someone that those are the qualities I would look for in any PT if Alex wasn't there. And so then I felt comfortable, you know, leaving my rehab in his hands and allowing him to do that, yeah.
Yeah, I think the most enjoyable phase for me was towards the end of the treatment care when he was doing plyometrics. He was doing a lot of jumps, hops, landing, etc. A lot of ladder drills, cutting, change of direction. We were doing all the things that require you to get back to playing a sport. Looking at that and then, you know, having those flashbacks of damn, he was in a lot of pain at one point. He was immobilized, he was on crutches. it really just like puts into perspective like these things change rapidly, but there's also a process that goes along with it. You can't do things too quickly. You kind of have to go by phases, right? Maybe there's that initial phase where there's a lot of pain. Next phase, we're working on getting single leg strength symmetrical. Then we're working more on absorbing force and jumping, right? There's different criteria that we look for, and I think that's the fun part, really just getting there towards the end.
Like two of the not maybe specific days, but maybe like weeks that really stood out. When we first started plyos, like from like the first time I did something like somewhat fast or dynamic, because at that point I had gone probably like 5 months of not doing anything like fast. So it had been so long since I had ever done anything like that. So that was pretty just like scary to do. But I'll remember like the first time we did like snap downs, and it was just like just something like crazy to think about doing again. And then before that, like getting out of the brace and just like walking normally again was something that felt different, but I wasn't really able to do squats. So even like doing half squats, like to a table or something like that, but actually like bending my knee and putting some weight through it was a time where I'm like, that's the first set of exercises that I ever did that I was able to like load my knee through. And that was a point in time where rehab like got real, and I'm like, okay, now I'm dealing with like the pain, like I'm intentionally, forcing it to do things it's not gonna like, the next day it's sore, but like, and having to like wake up and go through that and continue to push it forward was like a big part of all of it. So I've played sports my whole life, and I haven't really had any major injuries. So it was just like really interesting for me to document this process, because I was just like, this is my first time going through anything like this. So I didn't even know what it was before we officially started to document. I know I tried to just like film as much as I could, just because I'm like, man, like I want to look back and remember where it started and what we were going through. So I think when we decided to film this, I was just like, it's just gonna be so nice to be able to look back on the whole process and like kind of reminisce in some of that stuff, because I think everything like has a silver lining and learning pieces, right? So I'm like, even those days when it was hard and we were going through early stages of rehab, I'm like, I feel like I'm gonna want to look back on that as like motivation for like being able to get where I'm at now. So yeah, that was a big piece.
I think with my own like social media content, I post a lot of like rehab tips, exercises that I like, things like that. And I had never done anything like this, so I took that as like a cool opportunity to document that, help someone out, and same thing, kind of just look back at that progress and just see the development and see the growth in real time. And I think it was a really fun experience, because we had the full hour to just kind of just record, talk. Every now and then it'd get a little candid with conversations, but it was always a fun time, and always working towards new goals and trying to just get back to being 100%.
Thinking about it, I think, going back to like some of those candid conversations, being able to talk about some of the stuff that isn't really like things that are commonly spoken about, and you would ask questions about stuff like the insurances or like specific patient population, stuff like that. I think it was, or like tools that don't work, like just random things like that. I think it was nice to just be able to talk about that freely and not feel like, Alex may not put that directly out on his social media, for example, but being able to discuss that within the space, within a safe space to talk about. I think that was something that was enjoyable to do, and I think things that we have those conversations on a daily basis without cameras and mics around, so like being able to also get those conversations filmed was nice.
Yeah, I agree. I think when we would talk about just different protocols, different modalities, different treatment techniques, it was fun, because it was a different experience, like just openly talking about it, especially with another like fellow therapist, and then you were kind of helping with asking questions to really get us thinking, and I think that was very fun in the sense that we got to just really like just brainstorm and just kind of just say what was on our mind without really caring. I think that was fun. It was a good time.
It might be kind of vague, but I know that there were points where we were progressing in rehab, and it was just like really exciting because we were doing a lot of stuff. But then like the next 2 days, my knee was like swollen and just like I wasn't even like walking properly, and then it would be like rehab session again. And we'd talk about it, and it's like we might take it easy one day and then it'd be back to it. And there were a couple of weeks that were like that, which was like we weren't doing anything wrong, but like you said, rehab, it ebbs and flows. And so it was just one of those time periods where my knee was just like reacting adversely for like how much we were putting it through. But then getting past that, and I don't even think that was during a lot of the high level plyo stuff. It was like right before that. And once it got ready for that and breaking through that, then I think from that point forward, we were able to do all of the running and jumping drills and not really get too sore, too aggravated. And that was cool, because then that immediate moment when it would get that painful, then you start to backtrack and be like, okay, am I doing too much? Do I need to take a step back? Like, why is it hurting so much? Like, and you get all those thoughts like spiraling in your head. Even like me as someone that's in the space, like those thoughts start to spiral. So yeah, there were some moments where it was like that for a little bit.
Yeah, when I look back at it, I think about the times when we actually had trouble doing wall sits. So that was interesting. Like, of all things, wall sits were like super painful, and contributing to more swelling in his knee. So we kind of had to scale back and find modifications. One of those modifications was just changing the knee angle that he was in, and that seemed to help. But then at the same time, there was not much modification from session to session. But sometimes he would swell up, so we'd have to take a step back, and that was initially the first couple weeks, and then we got to a point where we didn't have to really worry about it as much. We did less manual, and it was really just more like strength training at that point, which I tell my patients all the time: if you're not on the table, if you're like doing exercise, usually that's a good thing. So that was it was fun to have that full hour to just kind of just train. I don't know, because I know that you have like. You respect me, you trust what I do. Like, I've never had that feeling like he doesn't believe in me. I've never had that feeling, which is, it's good. So I think it pushes me, and maybe you asking me to trust in your rehab process and lead it, maybe that just pushed me to be even better as a PT. But yeah, I think I've always had that confidence that you believe in me. So I don't know if it changed too much, but.
Yeah, I would say the same. I actually don't think a lot changed throughout the process. I mean, this location was being built before that process started. Alex, has been like my right hand for 2 years now, 2.5 years. And he knew, he was coming into this space. This is going to be his baby soon, right? And he's going to run it. And so all of those things were already in motion. So I think, maybe it strengthened our relationship a little bit, but I don't think much changed on a day-to-day basis because we kind of already had all the elements that we probably get out of that. Well, I guess though, again, like he already had that to be the person who got the opportunity to then now build this. And this is Brokaw is mine, but this one we're building together, and, he's here kind of running it. So that, I don't think that would have changed. But from a business standpoint though, he's kind of seen what we did with Brokaw and then, follow suit here. Yeah.
The early days, man, that's a good question. It was much slower. There was a point where I was only seeing like one patient every hour. So I had like 10 patients a day, and then it just slowly ramped up. And yeah, now I'm seeing a lot more. I enjoy it though. It feels like I go into work. Yeah, I know it's busy, but like I'm with people that I enjoy being around. And at the end of the day, I'm still out at the same time. I still do the same job, and it's enjoyable. And I think that there's benefits to both, seeing both aspects of the clinic, being like when it was slow and then now when it's busy. So I kind of know what to expect with this new clinic, because there's going to be a period of time where maybe I see only like 10, 12 patients, but with time it'll definitely get busier and bigger, and I think it has a lot of potential to be sooner rather than later.
Yeah, just context-wise, when I hired Alex, it was 3 people, myself included, on staff. It was myself, Alex, and a receptionist. And now, 2.5 years later, there's a total of 12 employees at that same location and 5 PTs or 5 therapists. So it's grown a lot and it's very different, but I mean, yeah, like I said, blueprint for rinse and repeat this location, another location. I mean, there's really no end to how much this can all grow. It's just.
So I feel like my role has went from, staff PT to more of like business partner and clinical director. So I think that's, I'm more on the business side of things now. I'm learning more about like how to run a business, how to run a successful business, and how to also be a good leader and build a good team. So over that time, even though it's been a long wait, I think it's been worth it because I've picked up skills. Like I've learned how to diffuse situations, maybe if they get tense, just working with KP. But I've also learned how to like ask people for reviews and how to like really just bring good service to the table. And I mean, every day is just a day to learn. But I think overall, like the business part of me has gotten much better, and I look forward to doing more of that in the future.
Right. I think like the biggest positive quality about managers is like being able to delegate and being able to be like hands off because you can't do everything, And so I think in this process to come, with Cherry, it's going to be a lot of, taking a step back, letting Alex kind of, do his thing, even if he's making some small mistakes like along the way that I made back then, maybe, not saying anything, letting him learn from him, things like that help you obviously grow to be better and become better at those things. But I think for me, just taking a little bit of a step back and and learning to delegate more and letting other people do some of the stuff, I think is what changed the most.
I think the thing that stood out the most is just how stoic you can be at times. Like you don't really, like even if you got like 10 things on your mind and you know that someone called out,
at all times,
patient left a bad review or whatever, like it doesn't happen often or ever really. But anyways, I think you do a good job of just like staying composed. Like you come to work, like you might have a lot of things going on, but you find a way to just not think about it and just get the job done. And put on the best KP you can with all your patients and with the staff, and making sure everybody's happy, making sure everybody is having a good time, and really just enjoying working there and being there.
Yeah, I appreciate that. I think it goes back to like the rehab side of things too. Like I trust him with my rehab, I trust him with the business side of things as well, which is a big thing. Again, like business is a whole different animal than something you go to school for and you have autonomy with. So I feel like Alex has seen kind of the process. I want him to create a little bit of his own path. I don't want him to mimic everything I did, but I want him to be able to grow and like kind of take some things that he liked about what I did, change some things that maybe he would have wanted to do differently. And I trust he's going to grow the business and do a good job with this clinic. And so, there's a reason that I chose him to do it instead of bringing an outside person in or something like that, So, did we walk in at 2 different times the first time? I don't even remember.
I think so.
Yeah, I don't know.
Yeah, I think I might have been traveling when you got the key, and then I got it when I came back.
Oh, that's right. Yeah.
When I came in, I was just impressed with the space, man. It looked nothing like this, but I just saw potential, and the wall was already cut out, which was cool. So we kind of just got to see how the 2 rooms would combine, and I mean, looks much better now, and there's room for a lot more if we need. But it's just great.
Yeah, it was pretty crazy to see. It's different than Brokaw. You guys will probably see, I think most of our filming was done in the second room, but with the way Brokaw was, like I said, I opened, it was just me and a receptionist. We had one room, and we took an identical room beside it, but didn't break down the wall. So it's 2 separate rooms. They each have their own vibe, but 2 separate rooms. With this location, we kind of saw the vision of how we were going to grow already based off of Brokaw, and so we were fortunate enough to get in and break a wall down pre-construction or during the construction process. And so we have a much just bigger total space, or it's the same square footage actually, almost identical, but because we got to break that down, the space is a little just bit more open. So being able to see that was kind of crazy, and we definitely took some things here that we wish we did have at Brokaw and made it better. So this just feels like kind of the 2.0, like new and improved version, which is nice to see. Bro, it's 1,600 square feet, both of them. But like little things, like having this instead of having the half wall with the curtain, like that's something I wish we had at Brokaw, was like a door in an actual room.
Yeah.
You know, like stuff like that I think like
Yeah.
we came to do.
The bathroom is nice too.
Having the bathroom is nice until you're gonna have to start telling patients they gotta hit the locker room because that's an employee bathroom.
It's around the corner.
Maybe Alex has a different answer to this, but from my side, I just hope like when I started the clinic and when I hired Alex and everyone else, right? Like I had a very specific idea in mind of doing PT differently than what most people do in terms of quality of service, in terms of like how we pride ourselves on our profession and just kind of bringing the best to our patients and getting that across to our patients. And I hope when they walk in this space, like we've invested money, we talked about the Oxfit and certain things, like I want them to feel like, well, they're coming to the place that feels like the right place for them because they know that like we're gonna do our best to treat them, and we're gonna treat them at the highest level that they can be treated at, so.
Yeah, I would agree with that. I think with this clinic, we're definitely trying to push more of like a sports rehab approach, and that's what I look forward to the most. Like having the Oxfit, having force plates, things like that, things that a lot of clinics don't have. I think it really makes you stand out, and it makes you a unicorn in this industry, which is really cool. I think that it really makes you stand out, and it provides people with services that you can't find elsewhere. And on top of that, you get the knowledge of working with us, and you know, we're passionate and we care and we want people to get better.
I think it comes with a lot of pressure, but we enjoy the pressure. Like it makes us better, so we welcome it. Finding something you're passionate about and being happy doing it, I think, yeah, ultimately, if I were to simplify it, I think that's being successful. Like, if I'm passionate about something, I can make a career out of it or a job out of it, and I'm happy while I'm doing those things, then I feel like ultimately I'm successful.
With me, I think it's similar. I have a wife and I have a daughter, so I think that blends into everything. So just being a great man, a great husband, a great father, and being a great physical therapist, hopefully being a great business owner. Those are all things that I think about every day, but maybe not directly, but like I want to be the best version of myself. And on top of that, I want to just be passionate every day. I want to wake up with like a smile, knowing like I like going to work. I don't feel stressed out about all the other variables. Like regardless, like I enjoy my day, and I feel like this is what I'm meant to do. So that's how I would define success.
But honestly, you know, a huge thank you to you for, this was kind of your idea to begin with when we first started talking about it, and
I appreciate you injuring yourself.
well, yeah. Honestly, without me, this wouldn't be possible.
Star of the show.
But no, this was a really cool thing. I don't know that I would have done it with anyone else and been this consistent with it. And so, you know, you coming and driving down, filming for us, you know, helping us out through the whole process has been super cool. And I think we talked about this, but I think this is a stepping stone to doing a lot of other stuff that could evolve into all sorts of things in this space. I mean, who knows? We might start a podcast.
Yeah.
So, you know, I mean, we really appreciate that.
Yeah. Thanks, man.
Yeah. All right. Well, we hope you guys enjoyed this conversation, some of these talks, this footage, you know, going through this journey with both of us, and yeah.
Yeah. Thanks for watching.